Hey folks, what's going on? I just wanted to make a quick video here for you guys on a Friday afternoon. I'm not going to make this one any editing pizzazz or anything like that. I realize that I've been spending a lot more time putting out videos because a lot of the time goes into the countless hours going into the video editing of these videos and so on. And I figured I'll just make it simple in the old school way. I'm just going to sit here and share with you a case perhaps and talk a little bit about some of the concepts that I wanted to talk to you about. Now, what I'm going to talk to you about is, you can see here, this is the EndoSequence file kind of evolution, the system of files that we've put out over the past 20 years. I'll probably have a dedicated video on the specific concept where I get a chance to introduce and talk to each file and its indications and contraindications, or what it can achieve, what problem does it solve, and why it's there. In the meantime, I just wanted to do a video to talk about a case. It's a very ordinary case, but it essentially uses the concept of blend. And what blend is all about is the idea of taking files from the two different spectrums of metallurgy, which is an austenitic file, which is non-heat treated. It cuts very well, has very sharp edges, but it's not as flexible, and combine that with a very flexible file that has perhaps it's modified landed design, so it does stay centered and it has less efficiency, but it has a little bit more flexibility because it's heat treated, and it allows you to manage the apex a little bit better. So combining these two files and come up with a hybrid system, which we call, Annie and I call the blend protocol, helps you be able to get and use each file in that portion of the canal where it shines best, using austenitic files up coronally, and then using martensitic files apically, and then blending the two together by creating a constant taper shape that is going to blend. Essentially, the idea here is the use of a shape membrane ITIL file, such as the EndoSequence or an ESX file. These are going to be super sharp in terms of cutting and work best in the straight or the coronal two-thirds of the tooth. And then you can use a heat-treated file such as the EndoSequence Scouts that have a modified landed design. And this particular file is going to probably shine best in the apical portion of the canal, where you're not trying to prioritize on efficiency, but rather on control and safety. And then once you're done with the two, come back and blend the two together and create, with that EndoSequence or the ESX file, that final shape that is going to be matched with the EndoSequence BC cones and hydraulic condensation to complete the case. Now, the difference between the EndoSequence and the Scout files is the cross-section design. Again, besides the metallurgy, in which one is austenitic, the other is martensitic. The EndoSequence files also have a very sharp triangular, true triangle cross-sectional shape. They have also ACP, which is alternating contact points, that allows them to help reduce some of the torque, that allows you to then use this constant taper without having taper lock and files getting kind of pulled in. And they also have an kind of an active safe tip, and most importantly, they're electropolished, so they're very nice and strong. And Scout files are heat treated. They have modified lands. They also do have a non-cutting tip, but they keep centered. And you can see this, a combination of these files. You've got 15 through 25. Actually, you have 15 through 45 in the EndoSequence Scouts file system with the 04, and now the 06 has been also added to the system. And then you also have the EndoSequence or the ESX files in the anywhere from actually 15 all the way to 8004, and then 15 through 50 in the 06 taper. So you have a ton of versatility and so on. But how can you combine these two and be able to get the most out of the system? Well, the idea is the idea of having a protocol in which you minimize hand filing. So you really have to scout and find your available length, and then achieve working length to a size 10 hand file, which means that if you have a molar, you may want to use an orifice opener and do a little bit of more mid-root shaping before you achieve that. But once you achieve that, then you can use an expediter file, which is size 30, to triage the canal into large or small, and then use a step back technique in larger canals, in which if the 30 goes all the way to the apex, then you are actually using either a 35 or a 40 to finish the case. And if it doesn't go to the apex right off the bat, the 30, which means you, for example, you have a molar or some kind of a thinner canal, then you're going to have to use the crown down technique, which means that you're going to go from large files to small files, and each file does a little bit of cutting before you move on to one size smaller and one size smaller, and you gradually work your way down to the end. And then once you reach the apex, then you move back up to a size 30, for example, 3004, to finish and blend everything together, and then fill with a size 3004 or larger based on what you have. So that's essentially the protocol, and the idea here is that you use no more than 1 or 2 rhythm motions to complete this case. And what you end up having is basically a 2-file system in easy cases that are straightforward, and maybe 3 or so files in more complicated cases. And the idea here is to have a expand style kind of a protocol in which you're able to use the least number of files for a given canal based on its level of difficulty. There's no such thing as a system that is going to be able to use the same number of files for every case, because every case varies in level of difficulty due to different calcifications, different curvatures, and so on. Then you also need to have a system that is expansive, it's versatile, and it can be adaptive to specific type of case you're dealing with. And that is the algorithm for that protocol that Annie and I, Dr. Koch and I came up with, that helps you use the least number of files. So I'm just going to quickly show you a case that is a fairly straightforward, easy premolar, that's a run-of-the-mill kind of thing that everybody runs into. And I figured this could be a good way of demonstrating the basic use of the blend protocol for your cases. So essentially, you always start by an estimated working length from the radiograph. Here we assume it's about 20, and then from the Rebuild Endo Access Kit, the modern Access Kit, I use the Sabercut burr, the 1558 in this particular case, and get my outline form. Then I'm using my E15D on the ultrasonic and my Forza V3 to just blend everything in terms of the access, remove that triangle of dentin up coronally that prevents you having straight line access. I'm using the E14D now to make everything blend a little bit more. And then the EndoSequence Flowable dam material to get that secondary isolation at this point that I have access into the tooth to see what we are dealing with. And I'm now using a size 10 hand file to achieve my available length. And with the available length, this is how far it goes. In this particular case, the file seems to be going down, and I use the apex locator to measure the full length. And it does happen to be about a size 20 millimeters, which is what our estimated working length was. So I go straight to my ESX size 3004, which is the file we're going to use as what is now the expediter or the screening file to figure out if we have a small or large canal. And look, the 30 ESX 3004 reaches the apex, that 20 millimeter that we achieved with size 10 hand file, within 2 rhythm motions. So all of that means is that all of those smaller sizes, 25 and below, are not needed. Now we're going to move up in the protocol and finish the case to, depending on gauging what kind of a large canal we have. So at this point, I'm using the E12 ultrasonic tip with the size 20 U file to just kind of remove some of the debris that's in the canal. And I'm going to jump from 30 all the way to 40. I'm going to jump to size 35, but I could just easily place the file by hand and see how far it goes. And I realized that the 40 is a few millimeters short. So by just going in there and doing 2 or 3 rhythm motions in each canal, I've now achieved the full working length. And I'm looking at the debris that's in each canal, and I'm realizing that there are some dentinal chips in there that are nice and clean. So I go on and use my ultrasonic tip. And since the 40 was, I was seeing that there is still some debris, some tissue in the flutes, I decided at this point that I want to move up one size to a size 45 before I finish it up. Now, could I have finished at the size 40 and irrigated more and maybe even done calcium hydroxide? I could have done that, but in this case, because the 40 did reach the working length a little bit easier, I decided maybe I should just go one size higher to a 45 to finish. And that's what's the beauty of this algorithm is that you're not limited to a certain number of files. You have a versatile system of files that goes all the way up to size 80 if necessary. Here the 45 which was needed, and I take the 4504 matching cones to now reach, and then I also noticed that the two 45s join at the apical like 2-3 millimeters. I do my full negative pressure irrigation and clean and dry the canal at this point, and you can see inside everything looks nice and dry. And I'm using the EndoSequence BC sealer to place the sealer in the canal. This I'm using the conventional tips, but I now prefer that you use the minimal waste tips because they're parallel and not tapered, as the parallel tip will help allow escaping, whereas sometimes when using the taper tip, you can lock in and actually end up putting too much sealer in. So place the sealer in, push it down to the apex, and I'm using the EndoPro 270 to achieve my hydraulic condensation by melting the gutta percha right at the orifice of the canals, and then place one and then place the other one and do the same thing. Sometimes putting both of them at the same time makes it a little bit more difficult to be able to melt off the gutta percha. You just have to be careful that you have enough space so that some of the gutta percha doesn't flow into the other orifice and block it afterwards. But here I did, and I managed to do them one at a time, and now I follow up with the use of the ultrasonic to remove any of the remaining BC sealer in the canal. And now I dry this space up, and it's time to fill the access. I'm using the EndoSequence restorative material, which is the BC liner in this particular case. And this is self-etching, self-bonding resin ionomer material that's been optimized to work with the bioceramic. And it could go over BC sealer or all the bioceramics, including MTA. And as you can see, this is a tooth-colored version. And I place it, I wait 45 seconds for it to self-etch and self-bond, and then zap cure it just for a few seconds at the surface. And you can see this is the final fill. I have done the entire root canal. We did manage to use this system to get around the curvature at the apex of the tooth. And you can see that we have even gotten a couple of lateral canals and accessory canals, and this patient did very well. And now at this point, the patient is going to see his general dentist for the restoration of the top of the tooth, which if they decide to place a crown, it would entail using a crown. They could drill even into the BC liner and use the rest of it as base to place the core, and so on. But this is a very simple case, and I wanted to just going to do this as a simple format because I tend to, as I mentioned before, do all of these other videos to get a little bit more complicated with editing, and that as a result, I tend to spend more time on it, and sometimes that's part of the reason why I haven't been doing as many videos. So I figured I'll keep it simple this time, just straight sit down and talk, and don't forget to comment below and let me know if you have any questions about the system. I will be releasing a series of videos about some of the instruments and materials and techniques that we have developed, Takachi and I and all the Real Endo team and staff together. We've helped develop these techniques for you. So I'm going to release some shorter videos for the blend, the SRCM, the hydraulic condensation, as well as the flowable dam material and a number of other materials and techniques in the upcoming weeks that are going to come. I hope you enjoy it. If you have any other questions, please mark them down below. I look forward to hearing from you, and don't forget to like and share the video if you liked it. All right, guys, I'll see you in the next video. Wow, why don't I do this every time? It's so much easier.